Hello, everyone. Welcome to the introduction for the READY trainings on communities in humanitarian settings. These will be COVID-19 micro trainings. The READY Consortium is a group of organizations with Save the Children, UK Med, Mercy Malaysia, Echo Health Alliance, Johns Hopkins Center for Communication Programs, or CCP, and finally, Johns Hopkins Center for Humanitarian Health. My name is Paul Spiegel. I'm a professor at Johns Hopkins Bloomberg School of Public Health, and I'm also the director for the Center of Humanitarian Health. And it's with such a pleasure that I welcome you to these trainings. So we are going to discuss learning objectives, who should take this course, the training schedule, what this course will cover, and then my favorite, meet the instructors. The learning objectives. Upon successful completion of these micro trainings, we believe that you will be able to describe the diverse and interlinking factors that affect community transmission of COVID-19, as well as the effects on other sectors and institutions. And this is one of the more important aspects of this training, is that while we are concentrating on community and community transmission as well as treatment, we also really want to be able to show the effects of if you're successful or if you're unfortunately not successful, what will be some of the knock-on effects that will affect other components and interventions in the response. And this could be from schools, health centers, hospitals, markets, protection programs, you name it. They will all have an effect if community focus on the community is not done well. Secondly, if successfully adapted, we want and hope that you'll be able to explain how community-based COVID-19 prevention and control approaches in varied contexts, and here we mean humanitarian, different contexts and settings from acute phase to protracted, from low income to middle income countries, displaced, non-displaced. Displaced could be refugees or internally displaced persons, as well as camp and out of camp. So there's a wide variety of settings, as we all know, in humanitarian settings, and context makes a huge difference on how interventions will actually be implemented. And finally, we hope that you will be able to adapt and strengthen your COVID-19 response plans and operations by modifying and integrating the three components, and I'll discuss those shortly, with the focus on community-based interventions, as well as considering the implications of various cross-cutting themes. So who should be taking this course? We spent a lot of time thinking about this, and we hope that it'll be humanitarian, non-governmental organization staff at the national and subnational levels. But this does not mean that it would not be beneficial for government employees, for UN agencies. We think across the board, but our focus is going to be on humanitarian NGO staff, and in particular, program and project managers, subnational managers, as well as coordinators at the subnational level, and technical and non-technical persons working on COVID-19. So I think it's important here to emphasize that we don't want to make you an expert in the areas that we're looking at, risk communication and community engagement, infection prevention, control and WASH, and community health programming. We don't want to make you a technical expert. What we want and we hope is that you'll have a better appreciation of these interventions and of these areas and how their success and their interlinkages with everything else you do will affect your programs. So this will be a 3-week program. We'll start off in week 1 on welcome sessions and looking at the first broad component, which is risk communication and community engagement, RCCE, which is essential in everything we do, and I'll discuss this a little bit later. We then move on to module 2, which is infection prevention control, IPC, in WASH, water sanitation and hygiene programs at the community level. Module 3 will be community health programming, again, concentrating on health, both prevention and some treatment more in the community and the household level. And then finally, on week 3, we want to be able to apply your knowledge, as well as the knowledge that you've learned through this training, as well as your experience in your context, to be able to examine your own plans and try to see how they could perhaps be improved. So there will be in a module, there will be a foundational content, which will be slides, PowerPoint slides, and you'll be able to see the instructor speaking, and he or she will be able to discuss the contents of that slide. But we know this is adult learning, and we will have micro training, micro trainings and modules, so there will be breaks where you can do this on and off throughout the day, as likely all of you will be working throughout. There will also be some expert interviews, and these are really important to both explain some of the technical components that we're discussing, as well as learning from them how they are adapting and the content that they're using and adaptations according to their context. Furthermore, as an additional support to the learners, there will be a moderated discussion board throughout. And there you'll be able to ask questions and the instructors will be able to respond, as well as your fellow learners, many of whom have a tremendous amount of experience. This will be a curated resource. There'll be collection materials and also additional materials provided to you for deeper learning. That will be during the course, and then you'll also have that when the course is finished. An important aspect is that we are trying to ensure and show you the interconnectedness between, in this case, the three areas of RCCE, IPC and WASH, and community health programming, how they can work together, how they can be integrated. And we hope that this will serve as further thinking for you, no matter where you are working, in health or outside of health, as a teacher, as a logistician, to be able to look at what you do and how you do it and the effects that it may have on other programs. Now, applying the knowledge is one of the most important things, I think, in any situation, certainly for adult learning, where we're hoping that both from the learning and then the knowledge that you've received from the three modules, you'll be able to apply your knowledge. And this is what's really important for us, is to apply it to your current situation, either your current plans, your current interventions and programs that you're working on at the community, at least looking at what's happening at the community in your areas, and then applying it to where you are, even if you are working on COVID, not directly with the community, but in a different area and a different intervention, as we said, maybe in a health center or maybe at a school. Secondly, we hope that you will be able to look and interconnect what you're doing, both from community all the way to the end stage of wherever that may be within the COVID epidemic, but also across the areas of water sanitation, education, protection, food security, nutrition, logistics, and health. And again, we're constantly looking for this interaction and integration. Now, finally, as a summary, community will be at the middle of in the center of everything. We have COVID-19 around, which is COVID-19 specific. We need to be able to respond and provide services, whether they be mental health, dealing with education, about COVID-19, but also the COVID-19 sensitive interventions. COVID-19 specific, but the COVID-19 sensitive, such as maternal child health, such as mental health, such as education. That COVID-19 and how we are responding, the emphasis that we are putting on this, have significant direct and indirect effects on previous programs or programs, essential programs that are already occurring. And we, besides the WASH and the community health program, we have the RCCE around there in dotted line, because we want to emphasize that RCCE is not an intervention per se, such as infection prevention, control, or community treatment. Rather, it is a way that we have to think, and we have to be able to think about how our interventions are perceived by the community, and how we can make sure, to the best of our ability, that they are accepted, which is working with the community, working with their culture, and working with the context. And we've seen the negative implications when this does not occur, not just in COVID-19, but in nearly every program we work on, Ebola is a very clear example. So finally, I'm going to be introducing you to the instructors. We have Catherine Bertram. Catherine works at CCP, the Johns Hopkins Center for Communication Programs, and she is looking in SBC and advocacy support, social behavioral change, and advocacy support in public health emergencies, malaria, child survivor, and nutrition programs for the past 9 years. And she did provide a lot of technical support in SBC and RCCE in the West Africa Ebola epidemic. We then have Abraham Verampath. Abraham is a humanitarian and development professional. His background is in environmental engineering, so you can imagine he'll be leading the IPC in WASH. He has a career spanning over 20 years, working with Oxfam and UNICEF, and since 2010 with Save the Children. And our last two colleagues are Donatella Messai. Donatella has over 20 years of international disaster response with a focus on emergency health. She's participated in cholera and Zika, massive outbreaks in South and Central America. For UNICEF, she's been an MSF country director and medical coordinator, and a general director in Italy of numerous important international organizations. And finally, we have Daniela Trowbridge. Daniela is a research associate at the Johns Hopkins Center for Humanitarian Health, and her research is focusing on large-scale outbreaks preparedness for NGOs. She has extensive experience leading and managing humanitarian organizations, programs, and operations with various non-governmental organizations. So that's the end of the intro and the welcome to this course. We really hope that you enjoy it, that you learn from it, that you provide us with your experiences so we can learn from you, but most importantly, that it has a direct effect on your programs, that you look at the community and perhaps see how we can work with the community in a different way, the interlinkages, and how working with the community will affect wherever you're working, if it's outside of the community. And we also really appreciate any feedback you may have. Thank you very much and enjoy the course.